Did you hear from Parker?
I did not.
Okay. So, hello, everyone. I know it's been a couple, I think it's like, since we met, it's been summer and now it's fall, so the weather has certainly
Or
changed.
winters.
I know. Well, there is snow in some parts of
Don't say that.
different mountains, so. But yeah, it's 5:30, so we'll call the meeting to order. We'll go ahead and get started with the approval of minutes. Let's see here from the notes. There was a motion by Emily to approve the 774 made. Oh, so go ahead. Sorry. I thought there was any changes. So any issues with the minutes? So the minutes would have been from our August 21st meeting. All right, would someone like to make a motion to approve the minutes?
I move to approve the minutes.
Great. All in
Second.
favor? Great. All in favor? All right.
Make sure we get
So
that
moved, yeah, so moved. So we'll go ahead and get right into our agenda today. So we'll start with actually, one thing, if I can just, I think in the email, that Emily had posted, for folks to think about their schedule or in the next couple months. So in November, we will have our meeting. Let me just call out the days, because I just want to make sure that the folks that are here with us today, if there's going to be any issues, as I know we're going into the holiday season. So the next meeting is November 20th. That's Wednesday, November 20th. Any issues so far from folks?
No, it's
Great.
seems to go.
And then in December, we are on the 18th. So that is the week before Christmas. Any issues with that date so far with those sitting here?
No.
All right. Great. So, so now let's go ahead and go to Steve for some fundraising updates.
Short update, we've had 5, I call them major requests outstanding. Since we last met, we've heard from 2. Hypertherm gave us 500. And, Mascoma Bank gave us 2,000, the same as what they gave us last year, so that brings us to 32,500, 2,500 short of our goal. 3 requests outstanding to Landecker Foundation for $5,000, Geocon for 2,500, and Jake's for 2,500. Those numbers are close or identical to what they each gave us last year. So that's another 10,000 outstanding now. I can't. Who can predict what they'll do, but I think our fundraising, the major gift fundraising is basically done. I think it's a good bet that we'll meet or exceed our goal just with that. Which is good news, but I think it helps us. I think we should think about pivoting very consciously from fundraising in that sense to educating and thinking about how we're going to convince people at town meeting to support this. So that's my report.
Great. Any questions? Yes.
If I could just add one thing to that, so the Burn Foundation, and I believe that it was received, but we didn't get an update for the September meeting, because that was canceled, but the Burn Foundation did give $30,000, and it very specifically stated in the letter that it was for 2 years of support. So that is our
That's good to know.
2-year donation expectation, so we will not be asking them next year.
Thanks, Emily. Any other questions about fundraising? Well, Steve, I mean, thank you for all the work and really putting that in and getting it in the time that, from the time we talked about it 3 months ago to now, so really appreciate the effort on that.
Thank you for the,
Yes, absolutely. And if we, in the future, if I think we're good for, like you said, so I think it's good to start thinking about, well, we have been, but to start shifting and really focusing on marketing and education, so. Great, so that leads us to communications and a little bit part of that would be talking about the campaign that we're doing. It's both a marketing effort to educate folks as well as a little bit of donation collection, but really it's focus on, marketing. So Emily, I'll turn it over to you for the mailing draft. And I hope folks were able to receive and look at the draft, so we could collect comments and get feedback pretty quickly if there's any changes.
Sure. I was trying to share the screen so that everybody who is online will be able to see it, but I have not actually utilized that function. So let me see. Just a moment, sorry. Thought I had a way to share my screen.
Oh, the share.
Well, that's what I thought, but
And then go ahead and pick which window.
maybe.
Yeah.
Ah, thank you. Thank you very much, friends. So sharing the screen for what was distributed for, all of our committee members for the proposal of the mailer to be sent out in November. This was drafted, in kind by an Enfield resident who was ready to lend a helping hand with getting that drafted. Yeah,
So we'll open it for feedback now, in the next few minutes here. So anyone want to start us off? Any initial feedbacks, edits? Yes, John.
My first thought, I think, I mean, I think that, somebody's obviously put a lot of nice work into the graphics and the colors, and I think that's great. Was that there's not anything other than in the donation thing, it doesn't say community nurse project. So I'm wondering if there's some way we can put it, if people think it's necessary to put it somewhere, either in the, the explanation on one side or the other, because I think it might be confusing to people to say, I'm donating to the Enfield Community Nurse Project, but it's not, there's mobile integrated health, there's Dartmouth Health, there's the town of Enfield logo, Lebanon Fire Department. I mean, all that's fine. It's true. It's good, but I don't know if there's some way to work in that this is the Enfield Community Nurse is what we're talking about. Does that make sense?
which is sorry, just a point of order kind of.
so this would be the front facing, this is where the address would go, the postage stamp, etc. And then there's room across the bottom because there has to be space for specific postal code things when it goes out. And then this would be the back. And there is this blank space is the holder for the QR code that I am still crossing my fingers and toes that I will be able to work with our assistant town manager to finalize. However, I do not have any guarantees at this point in time.
So any comment, any feedback to Donna's remark? Yeah.
Yeah, I guess I'd just like to second the motion. I mean, the first word is Lebanon and Dartmouth Health, and I just think it somehow should say Enfield Community Nursing. That's what we're advertising. That's what our clients care about. They don't care about Lebanon or Dartmouth. They care about Enfield, and they should care about community nursing. So maybe the issue we have is with that first paragraph above the pictures and who is eligible and the services provided. I just don't think we've hooked this is a quick read. At least half the people are gonna throw it out immediately. We've got to hook them right at the start. We've got to put something that catches their attention, and
Yeah.
That I think is lacking.
I also thought the same where it really should be a call out to an Enfield resident. I know that it seems like it's already that way in the front, but when someone turns it, it loses it. So I thought of adding something like dear and Enfield friends, Enfield residents, or like to Enfield friends, residents, comma, the community, the Enfield Community Nursing Project is excited to share with you, and then continue on with that. So something more of like, I'm adjusting this group and it is from here and this is what I'm gonna share. So if it can be, I think there's enough room to, to put it there. Even if the texts are smaller, but like a call out again to the residents, and that way it also mentions our name in the front. Kristen, your hand.
Trying to find the unmute. First of all, Hillary is brilliant, and she just does beautiful design. The one thing I would really add is getting feedback from older adults, most of the population that we serve from, but somebody from like 80 and older, about fonts, and because it's very busy. So I would really want feedback from maybe some of our clients to say, does this speak to you, and would you access a nurse based on this card? But Hillary is super talented, and grateful for her work.
Other thoughts? Thank you, Kristen.
I mean, can I see the card again?
Yeah, I'm going back.
Yeah,
I'm
that's
just looking
fine.
for that. Yeah.
I don't know if it says anywhere on there about, like the donation area, like you said, for the infield, community nursing, but maybe donate to Enfield community residents in need or something. So it says donations to the Town of Enfield Community Nursing Project are appreciated. But like calling out that they would be supporting someone in their community that's in need for nursing. So that would speak to me, but. Cause there's a lot, like Kristen was saying, there's a lot of information on there. I don't know.
Yeah, oh, yes, sorry.
Yeah, I hesitate to make a suggestion to add information, but it also doesn't say that this is not, it probably says it's free somewhere,
It says free program for Enfield residents right on the front.
but it doesn't say that it's free because it's supported by
Supported by
donations,
our community.
and therefore your donations are appropriate, appreciated. I don't know.
How you include that.
I don't know how you include it, but it would be nice to have there.
Well, maybe in that same section where Sheila's proposing the changes, your donations go directly to fund this program and are appreciated. And then, please consider making your donations to the community, the full name. So you can tie it in that donation section as well. So that way when folks because that's where they're gonna look, if they're gonna write a check or if there's a QR code, that's gonna catch their attention too. So it almost seems redundant because it's already saying checks can be made to the community nursing project. So if we just say like a phrase like that, like your donations directly support this effort or something to those lines, and then say checks can be made to the community nursing. So.
Yeah, I think adding just the word your makes it more personal, your donations.
Yeah, go ahead, Donna.
Just to piggyback what Steve was saying, I think, because, when programs are free, right? Like the way that's written, it seems like it's free because it's mobile integrated health, and Dartmouth is making it free to Enfield residents. And so I think, Afriel, you kind of said this too, we might say like free or due to support from the Enfield community or something like that, or free. Something that it's the only reason it's free, but to stress it there, it's because of community support. Right, because it's not really free. Right? Nothing's really free.
Right.
I
Oh,
was
that's
gonna
a good
make a
point.
point
Not
to
anymore.
support
It's
not
got no
pushing
cost.
free too
Right,
hard.
right.
Because there's no such thing as a free lunch.
Yeah.
That's what my economics teacher taught me, and but that's also something that we need to keep in mind as we move forward with potentially moving this to something that we hope for the town to fund, is that
Right.
then, like, that is a perspective piece that will be important to a lot of people. And so kind of being careful how we use that will be important in our verbiage.
Right, so it's like delivered at no cost to, to Enfield residents because of the currently the donation, the grant support and whatnot, but so somehow saying, like I say, it's free to residents. But somehow connecting that the only reason it's free is because of community support. It's not free. Dartmouth's not doing it for free. Lebanon's not doing it for free, right? And so the community support can now be like asking for donations, and we could transition that to the education piece about adding it to the Enfield budget, right? The town of Enfield's gonna support it. That will be our transition of education, but
Maybe saying how to support, like, and then have that information, like, how can we support? How can you?
How can you support?
How can you support
Mhm.
our community members in need?
I've,
I think,
oh,
go ahead.
Yeah, I didn't see fall prevention or anything about falls, and that was the number one reason, I think, why ambulance services have been called an Enfield. Is that right, Emily?
Yes.
Yeah.
Yeah.
So I think that would speak directly to a lot of people.
I think it was hard to pare down what could be fit on
Mhm.
such a small card within the kind of text. And so I think maybe that was one of the things that kind of got lost. But
Right, if
I can
wound
see
care is
where-
only provided by
Yeah.
paramedics, that could be left off and put fall, I don't know, assessment for falls. Or
fall prevention.
fall prevention.
Oh, so under services provided, that's
Yeah.
where okay, gotcha. Yep, okay.
And then,
Sorry, I was looking at eligibility and got lost in the sea of words.
Okay, yeah.
I think the design is lovely.
Kristen and then Steve.
And when go ahead and unmute yourself, Kristen, I'm sorry.
Here's,
Nope,
yeah,
just undid it, sorry. Not mean to do that.
You're
Almost.
good, no problem.
No.
I'm just curious, kind of, as an Enfield resident, if I make a donation, am I covering costs of MIH, or is this for the community nurse? Like, if I'm looking at this, I'm thinking I'm making a donation to the MIH program. Well, again, supporting Enfield residents or not. And I don't know that are we going to be asking taxpayers to support, Jeremy's services as well, or just the community nurse? So it's a little confusing to me as a resident.
Mhm.
Steve.
yeah, I don't know how this job gets done, because editing a document in a committee is kind of a non sequitur, but I just think my opinions. The information under who is eligible seems to me too detailed and kind of cart before the horse. I mean, it's all important information, but it's information that can be provided when somebody calls to get a referral.
Mhm.
I know someone who's 55. Are they eligible? I mean,
It's not relevant.
The eligibility.
I guess just like the Enfield resident would be for me, right? Just in case somebody but if it's not already
If
clear,
it said Enfield
Yeah.
Community Nursing.
right, so,
That'd be pretty strongly
Yeah.
implied, so I think there's a level of.
but I don't think it says that on the top, does it?
No, that's. what I
Yeah,
mean,
yeah,
is that-
so that's why I
Needs to
think
say it,
like,
yeah.
it needs to say that,
So I
definitely
think that
needs to
whole
be.
block is kind of at a, I'm not
I-
saying none of it belongs, but too much detail.
yeah, almost like you could maybe even just put the website to learn more about
To
eligibility,
learn more, call,
or to learn more, call.
Yeah.
Yeah,
for sure.
And that could be where this, so that would be the services provided, right?
yeah,
Um,
Jeremy, go ahead.
all right, so I have three things I want to mention. One, how do you design a thing by committee? We make a list, we send it to Hillary. She's very, very good. We won't get every single thing that was discussed here tonight. Might get some stuff that wasn't discussed here tonight, but that's what she does. So hopefully, a good compromise means nobody's really happy with it, so hopefully we'll get there somewhere. I'm hesitant to suggest that everyone just pick up the phone and call.
Oh, no.
We have 10 hours of services and no administrative staff. So if everyone's just calling to ask questions, that's all Rachel will ever be able to do. So if we can say, go to the webpage and to make a referral call, or to refer yourself call, or something to that effect.
Yep.
But I think that sending people to the webpage is a better idea than just having a phone number. We can make it a little bit too easy.
So here's an idea. What if I don't know, again, if the QR code for the donations, but we can do a QR code that goes to our website. And we can have a visual that's made for the website, even if it goes to, the flyer that Cindy has made, things like that. Like, we can add something that doesn't add a ton of verbiage, but can be additional information provided, kind of redirected. That's another option
Yeah.
of a tool we could use to try to, there's more information, see here.
I would, yes, the QR code, I would still have a website, because if you're not someone with a phone, or you don't want to use a phone, you don't normally use a phone that
Oh, yeah.
way, then I
Yeah.
think you need to be able to type it in as well.
Is there a phone that somebody could call that's not a community nurse? Like, do we have an Enfield phone that somebody could call, or no?
That would be me.
Is that something we put out there? The only reason I ask that is there are also going to be people who don't go to websites, right? I mean, it's not the majority of people, but there may be people who do want to talk to somebody on the phone. But it may not be appropriate, so if it's not, that's fine, but just a
Yeah,
thought,
I mean, is that impractical too, or
right?
I just don't know.
Yeah.
No, I mean, at this point, I mean, my contact information is a part of the community nursing committee, like, website page. Like, if you have questions, contact. And like, I even received an email today just asking about, whether the meetings were public and how to access them. And I was able to respond in a timely manner and give all of the information. So, I mean, it's definitely, I think it's within the wheelhouse of making sure that they have someone to contact, because when it comes to either, trying to help field calls, help answer that information, it's not our nurses who are, but if it's something above, my level, I'm more than happy to say, you know what, that would be a great question for Rachel. Let me help you get in touch with her.
Yeah.
But I can help answer some basic questions and direction on how to do that. And some of it, honestly, most of the contact that I've had with people regarding community nursing has been really a lot of reiterating what we have out there already. It's just maybe not been seen or kind of understood in that way, which is fine. Like, that's not,
Yeah.
I'm more than happy to talk with someone about it to make sure that they have that comfort and understanding, because that's a part of what we want for our residents, is to have that personal kind of connection and with our nurses, and, being able to talk with someone in town before they talk with one of our nurses.
I think if
That's
you
what it's
have-
all about.
I think if you have the bandwidth
Mhm.
and Ed approves you're taking that time, I mean, that's a major part of, that's like the first step in our education and outreach program right there. And you're the exactly person to talk to, and they've shown interest.
Right.
It's a lot more direct than standing up at, as we will next March.
And I'm not saying
Giving
that
flyers
Rachel or
out.
I won't do it. I'm just saying we gotta be careful.
Yeah, but I think.
This is
Understandably
true.
so,
Yeah,
and
exactly.
yeah,
This is
very
true.
respectfully, so
Exactly.
yeah,
Exactly.
absolutely. And,
Yeah.
but it's the way that it's actually, I will say I am very grateful that I became involved when I did, with the project because it has been very well integrated into a lot of the emergency services kind of in general, and it has been a great kind of blanket with, Rachel is, working with the fire department for some space to be able to have space, physically in Enfield. But then I'm also working with her on the phone, for other things. And that's even through my work at the police department. And so there's actually a lot of crossover that works really well with public safety and administration. So, I mean, I don't see anything wrong with kind of directing phone calls or questions to myself to be able to help navigate that.
That's great.
I will confirm with Ed, and my supervisor, obviously, but it kind of seems like it's already in line with how we are operating
Operations.
and
yeah.
how it's represented on the town website and things of that nature. So it's just kind of putting it a little bit further out there, really is the push that I will assure.
I think it's great.
So can I try to summarize and then folks can add to it? So it sounds like the first page there, we need a more call out of the Enfield Community Nursing Project. And it could even just go, Enfield Community Nursing Project presents mobile health, program free for Enfield residents. The word free could be, could also be no cost for Enfield if folks don't, so if free seems a little bit more like there's no cost, but it could just say no cost for Enfield residents, because that's true. It's different than free. It's like not at this point because we're not paying for it with our taxes. So that's a true statement. So something along those lines. And then on the second page, that first paragraph just needs to have a more personalized tone of addressing the residents again and calling their attention. Perhaps mentioning our name once again, removing the eligible, who's eligible section, and perhaps replacing that with the QR code for more information and the number to Emily, well, the number to the town, which Emily picks up. And then it sounds like in that donation call out, we'll also need to personalize it a bit more to say, your, support. Sorry, Sheila, I know you captured it previously, but something along the lines of how to support your Enfield residents in need. Something along
Or
those.
maybe like
Here's how you can
neighbors.
support your community.
Here's how to
members.
support your Enfield neighbor.
I wrote it right into the
Yeah,
email.
okay. Yeah. And then if we don't, and perhaps a QR code, if we get a QR code for folks to pay, otherwise that could be the placement for more information.
And fall prevention.
And then the change from
Yep.
removing wound care to fall prevention.
Oh, removing wound care. Okay.
And then to Kristen's point, I don't know if we'll have enough time, but if we could really have someone, in that age range to review that draft, that would be helpful. So if folks have ideas on who that might be, who we could approach, as other folks from other committees, perhaps.
And along those lines, Dartmouth, I don't know if this is only volunteer, if Dartmouth is involved with that, but just to make sure the readability, right, you want to have it 4th grade level readability for general public, like those sort of things, along with the font and the spreading out. And then one just thought, I don't know what people think about this, is so where we would take out the who is eligible, if we put the services provided in that spot and the QR code down at the bottom or more information.
That's kind of what I had pictured in my head as we were progressing. Yeah, I agree.
Yep, that would free up a lot on the bottom to talk about donations.
Donations,
Um,
website, phone number,
yeah.
QR, yeah.
One of my other questions also is, we've already had donations and we've had, do we just say a blanket statement, thank you to our
Mm.
corporate sponsors or our corporate donations or is that not the place for that? This is just a thought question, not
Mhm.
really. Have no feelings about it either, but because it is going out publicly, right, and.
Thank you for your ongoing support, yours, yeah.
I think the real estate is so
Yeah.
constrained.
Yeah, or maybe in the QR code, we create a like where we add more information, we do call out who has been our donors and our sponsors and just
I can't remember, is that information on the website somewhere?
It is, yep, it's on the website under, I think current fundraising or something. There is a tab on the left-hand side that updates fundraising and has a whole list of thank yous to the organizations and businesses that have contributed.
I mean, just back on the
Yeah.
real estate, I
Yeah.
know we're gonna discuss the flyer later, but if you sort of looked at the flyer, which I happened to be looking at, you get a sense of how few words we have to deal,
Mhm.
that we can actually
Yeah.
deal with, and I think we've got maybe 3 times as many words on the current draft
Yeah.
as we actually will have, so.
Yeah.
Hillary's gonna have to be, Hillary, is that her name?
Yeah.
Yeah.
Sorry, gonna have to just pull miracles to get this on.
Tear it down.
Yeah,
So it sounds like we have the summary in general that folks have been in agreement, with the exception of who might be in that age demographic that could review it for us. All right, any other comments?
what's the question? What's the procedure now? that we
Yes,
go
I think
through to get this finished?
So, one thing that I did do, just between the cancel September meeting and now is that because we were aware that, APD wanted to have approval of the final product before it went to print. I did initiate that contact and, honestly, I'm glad I did a little bit ahead of this because I learned that some of the communications were rerouted and some of their shifts and changes that they had happening kind of in their operations. So I am awaiting just kind of like some type of point of feedback from them based off of this draft. Kind of with the point that this is not the final draft. However, we need to have some type of communication starting point to be able to have that stamp and go to printing. Because that, I don't want that communication timeline to have us hanging up in the end, so that was initiated. And I have not actually heard back on this draft as it is, so, and then knowing that, I've already started drafting the email to Hillary with the feedback of, kind of how we have reimagined kind of what is here and what with the space that's available. And I'll probably stick very closely to those very specific points because those are the actionable items that make it easy to say, you know, take this off, put this on, move this here, shift this there. I think the question that I have at this point is just verifying, like, because if we are going to have a QR code on there, and we will not have time prior to the next meeting to be able to finalize what that is. We need to know here and now what that QR code is going to shift people to. Cause there needs to be a very specific landing page to have a QR code. So if we want to give a QR code and, you know, we can give the City of Lebanon MIH page, the web address in text, but if we want to do a QR code, we as a committee should have an understanding of where we expect our QR code to land people on the other end. So that that's clear, because that's gonna be something that I will try to work with Hillary on.
I'm a little confused. I thought the QR code, originally the idea was for payment.
Yes, so you can have QR codes for anything. But the idea was, yes, so the QR code to make it easy to make a donation. But we also talked about having a QR code that would land people to more information that could be presented in a different style, on a larger format, et cetera.
Hmm.
Can they be the same one on Enfield's webpage? So that landing page, it would be like a couple of tabs for more information or to make a donation?
I,
Or is that too big of an ask?
But actionable, like where you can say, I want to make a donation, you click the top, make it easy right there in the top part, or if they want more information, it's below.
that would be a whole nother can of worms to create, because I don't know about creating a donation page that's linked to the town website.
Okay.
That's a whole new,
Correct me if I'm wrong, the QR code donation, we're gonna be using someone else's PayPal or Venmo. Is that
well,
correct?
so the goal was to have it be the towns.
Yeah,
Um,
so,
unfortunately,
the
what
real-
happened was that it was set up in a previous town manager's name. And so now we are stuck in the cycle of, you need to have proof of this, and you need to have your birth certificate and 5 pieces of, no, it's not actually that, but still, it is that rigmarole of, jumping through hoops of fire to try to get it turned over to the correct authorities, to then try to use it as you wish. And so we're in that flux of, are we going to be able to get all of that information to be able to turn it over and utilize it, that this committee sees, would like to, because on the other end of that, there is an accounting portion that is,
so we don't know for
Complicated.
sure how we're gonna collect donations at this point, is where we're at.
right.
I thought there was a conversation about asking the PD or somebody who already collects donations, if they could collect on our behalf.
Yes,
Is that any progress in that, or no, we're not allowed to? So we
There-
can't use it.
huh?
We can't use it then.
No, unfortunately, there's, with what is already happening accounting wise with the bingo and other things that are happening, it is not going to be effectively manageable.
Okay, so maybe let's work from, when does this need to be in the printers? Cause if we're trying to mail it the week of the 25th, is that what we agreed? The Thanksgiving is 28th. So we want it out at least the 25th. It would probably be a quick turnaround because it's just in town. So when would this need to be printed?
It would actually need to be submitted to, so there is an entire. I met with our postal person, Troy, who is phenomenal. And I brought him the mess of papers that was the information for all of the permits and things like that. And he said, I don't know how to do those. And he goes, and every time they come in, they're wrong. I said, oh, that's very helpful. Thank you. But in his infinite wisdom, he did show me where to go to. He said people are going to, I can't remember it off the top of my head. It's one print. It's one click and print where everything goes through the US Postal Service. So you submit it, it's printed, it's postage, it's done. Like
Okay.
you literally hit submit and it's gone, done.
How
But-
long of a time, so when is their deadline to be able to meet?
There needs to be at least 10 to 14 business days.
You anticipate like with the holiday, you know how you have to hear back from APD. That things just kind of slow way down. I mean, if we need their approval, that could be a big barrier. Is it better to put it out and have everything done well? Versus like the timeline of hurrying it up to get out, if we don't have a way for people to easily donate. At this point, is it worth spending over, was it $3,000 or $3,000 for these? And if it's not all absolutely correct. Need it to be.
Are you saying to push it back after Thanksgiving?
I mean, it's better because of the winter months to have it out, right? Because people have falls that, people are getting sick. But if we can't, if it's not an effective mailer, should we push it out? I guess is my question. I mean, if we feel it's important, if we're not accomplishing our goal of people being able to easily donate and also getting the information out to the community, well, because of the landing page situation, where's the money gonna go? The QR code, we have APD, all of these kind of barriers. you know, maybe we tentatively push it out a little.
A lot. I think.
I think January,
I think
honestly,
January.
so
I
unfortunately,
don't think there's any point in putting it out. in
why spend that
December.
money?
If we can't, if
The
we,
money
I
will be
agree.
available in 2025.
Okay, so then we need to do it in
I
December.
mean, even,
Yeah.
but right, but if we can't get a donation page up, it almost, and redesigning this obviously to make sure that people, it's much more clear, maybe getting a few feedback. I don't think, if we're working with that November 25th, we would have to be done it by November 4th, at least November 4th, the week of November 4th, to even try to get it out before November 28th. If we're talking about the 10 to 15, I went with the 14 days, just to be on the
Yeah,
maximum
yeah.
end. So are we gonna be ready for the first week in November?
Doesn't seem that way.
Not if we don't know
I
that
think
there's
there's
a
a lot of
donation
questions.
page.
There's
Credit Union just did a citywide mailer. And it was like less than a week turnaround. And we did stuffed envelopes.
You stuffed them or you did them
The
through?
company did everything. Individually addressed, not even to dear postal customer.
Was it through the US Postal Service or was it through a permit?
No, it's through no, we're paying individual postage. You don't get money back on returns.
Huh.
So they just literally pull every address within the zip code, and send it.
So even if it's that way, are we gonna be ready by November 11th, the week of November 11th? Let's say, because we would give a week, 5 days. Are we gonna be ready in the week of November 11th?
And,
Yes.
and this committee somehow approve a draft when it's not at a meeting,
Right.
or do we just skip that and say,
So it almost seems like it does, yeah.
Well,
I mean,
don't-
that's,
We're either all in or we're gonna
The
have to
proper
schedule an
procedure-
emergency meeting to try to reconvene to get it out in that specified timeline.
The general procedure would be that the committee would vote to authorize a member to make that decision.
I wouldn't be comfortable with authorizing one person, but if others are, I could vote on it. But, we could put that on the table, but
that's a hell of a lot of responsibility on that.
certainly
one
don't put
person.
my name on it.
Don't put my name.
So
Hiding under the table.
yeah, I mean, how Hillary, with these edits, how long do you think Hillary would be able to produce the next draft?
I mean, when
Is my
I,
next question.
cause she gave me an initial draft and I had actually given her feedback fairly immediately, cause I said, oh, we don't have this or that. Like, there were two things and I asked her and it was very quick turnaround as far as that. Saying that, I don't know what her workflow is right now to say that I can guarantee that. I mean, I think that
Would,
she would get back to us fairly quickly.
and then would the town have options for us to receive donations? Like in 1 month? Or that's just gonna be a problem and in that case, we're gonna be stuck with the same thing. How do we receive donations?
Well,
Because if we're not able to collect donations, is that important to us? For this mailer, or do we just nix it out? So that's a question to the group.
I have a question. I know I missed a couple meetings, but what's the follow-up plan going into the next year? Or is there gonna be a follow-up to this mailer? Like, is there gonna be stuffed envelopes or maybe an envelope for their donations going out for people to put checks in that would follow this? Is there money for that or something to follow? Because people respond when they see something more than once, right? That's just marketing. And usually it's a lot more than once. Obviously, we don't have the budget for that.
Turns out
But if it-
return envelopes and tear offs are stupid expensive.
Are they?
Mhm.
Yeah.
Mhm. You're also adding postage for that.
I just didn't know if there was anything to follow after this,
Mhm.
if
Yeah.
we've talked about that. Because I think it matters if we're making a decision to rush this or not.
Yep.
You asked if the Okay, you asked if donations were important. I think,
Essential.
well, I think I tried to make the point at the beginning of the meeting that we've essentially raised the money we need. I don't think this flyer, the motivation behind this flyer is to get donations. I think we put donations on it because that helps to gain buy-in. And even if we don't need the money, we need the support. So the motivation in my eyes for doing this whole mailer is to gain support, to help educate people, let them know they probably don't even know this exists. If they want to make a donation, that's great. So I don't think we need a QR code or a super fancy way to do it. I think it currently says send checks to. That's a perfectly acceptable way to do it.
Yeah.
If you agree with my analysis of what the motivation is.
So if that barrier is out, then there's a possibility that we can still meet that deadline of, but we're not in agreement that we would have one person approve that draft. So it sounds like we still should think about it in somewhere in December then, because we're going to meet on November 20th and we can approve that final draft on November 20th.
I don't know what the sense of the whole group is. I know what the school coordinator seemed to think about delegating this, but if delegating is not on the table, then I propose that we plan to approve a draft on the 20th. We've seen a draft a week before. We have minor changes. Let's hope. Then we can approve. The whole committee's behind it. And we mail it as soon as we can.
Yep. Any issues with that?
So if if it is, the next draft is sent out by email the week or so before, and I think we talked maybe that we might do this. Like, we can't talk about it on email, but we could directly send Emily or whomever, one person, right? Feedback that could be brought to that meeting, or no, we would just have to discuss it at the meeting.
It's best to avoid that
Yeah.
altogether, because when we get into that, that's when you kind of enter that realm of one person replies all, and then here's our 91A, like, gray zone that could easily get us caught up. And so that's what we're trying to avoid by sending it out. Here is our meeting packet that will be presented in our public meeting for public discussion kind of thing. It's, yeah.
So we won't really, it'll just have to be, we'll hope that everything looks good on that meeting, so that would be the first time we really can.
That's a huge ask of Hillary. I know
Yeah.
you said she's a
But
miracle worker, but boy, I mean,
I think we have a really good foothold with our starting point. And I think that there's excellent, like, very, kind of mindful feedback as to how we can tweak what we have available. So I feel good. I feel very confident about kind of like what feedback we have and kind of very specific pieces of like where we could kind of tweak that to be kind of what we would like to see. So I actually feel pretty confident that we could have a really good draft that, just based off of the conversation, because like the design, the layout, like there's no major changes. It's just kind of, can we move this verbiage here? Let's highlight this, we're not gonna worry about the QR code. Like, I think it's all very
What's
easy.
the expected timeline for APD to get back?
Right.
See, that's
the wild card, right?
That's the wild card, and that's again why I'm glad that I tried to get a little bit out in front of the timeline.
yeah, plan.
To try to get some feedback from
Right.
them. If there was something we should change, then I could have presented that to the committee tonight. But I didn't hear back to, like, it's one of those like, hey, I got in touch with someone who had been handed off to at some point after we had already been awarded, and then reaching out to that person, waiting timeline. Oh, now there's a new person and there's a whole new committee that you need to present
Oh
to.
my God.
So I think we'll just hope that we'll just get an update on November 20th, and maybe when you send out the packet, you can let us know if there is feedback from APD, and if there's not, that would determine what, that's clearly would say we can't move
Are you
forward.
able to send, if Hillary, gets together a new draft even before we approve it, send it again to APD and maybe that will,
Oh,
like,
absolutely.
them
Yeah.
ahead of time before we even look at it?
Oh, yeah,
Okay.
absolutely. No, I'll stay on it to try to keep it moving and keep it kind of relevant.
All right, so folks should expect to see the draft before the November 20th meeting, maybe a little longer, a week or so before, and then have some feedback, and I would say keep it at the, don't let the perfect be the enemy of the good, so just keep it at the, at any egregious or any issues that, obviously need to call out. Next we have flyer updates. Oh,
I
yes.
have one hand raised. I just wanna.
Oh, sorry, Kristen, sorry.
No problem. Emily, I know the new director of community health at Alice Peck Day. So if you don't hear anything, if you want to email me, I can put you, I mean, she's not the grant approval person, but I can put you in touch with her to try to get some feedback quickly. So just let me know.
Awesome, thank you.
It's good to know people.
Yeah.
Good to know people in high.
That's right.
Thank you.
All right, Cindy, flyer updates.
Okay, I added the nurses are contracted through the Lebanon Fire Department. I apologize for the typo on the first one.
Any feedback from folks? Or I'm assuming you're just collecting feedback now. Is that correct? And just any changes or,
That was the
Yeah.
only change from the last
Yeah.
meeting.
for those that weren't here in the last meeting, any other feedback?
I think it looks really good. Yeah.
So, good. So if anybody has any, community groups or contacts that, would like to, we think should have these, let me know and I'll add them to my list.
And how do we get them printed, created?
I don't know, is there money to get these printed? I just ran a few off at my house, but
That would be, I mean, so yes. But also that would be a committee discussion on where we would get them printed, how much we're looking at cost wise, things of that nature.
right, I thought this was gonna come out of the grant from, the Nurse Connection. But
Yeah, so that is all a part of the current mailer, so because we have the mailer kind of wrapped up in that,
Mhm.
I can't predict exactly how much is going to be left over, but it would be a committee discussion as to, hey, do we wanna say we should use $50 to have him, X number of copies printed off at, not Noman Copy, but one of our area cop Staples, and we can pick them up and I can have some at the PD for disbursement. Each committee member can have some. I mean, that's just an example of how we could roll with it.
Well, why don't we take it up at the next meeting, but in the meantime, I'll just copy off as I need them. I
Okay.
print out as I need them, because I don't want it to hold up
And we,
progress.
then somebody come to the next meeting with, cost estimates, so we can maybe take a vote on
I can,
getting 200
cost
or
estimates
500 or
from
5,000 or
yeah.
something, yeah.
Okay.
I mean, I think it would be great to have a big stack of these.
Yes.
because- And everybody have a bunch, because
Yeah.
who knows when the next
Yeah,
group
there's
of 5 is gonna be, and I think they're really excellent.
yeah, and I think doing it like Staples is great. I think there's budget printing also, which is a small
There
owned
we go.
business.
Yeah, but
That might be more reasonable, so that would be helpful. Thank you, Emily.
Yes.
All right, so moving along to program evaluation. So the data from August. Sorry, not August.
we actually have
Well, actually,
August
yeah,
and
August and
September.
September, so. If folks have had a chance to review it, are there any questions, comments, feedback?
I had a question, is Amanda now stationed in Enfield one day a week?
Rachel,
Rachel, sorry.
yes,
So which day is she here, or does that move around?
So when I last spoke with her, she had tried to kind of narrow it down to one day to be in Enfield, but she was finding that it was hard to get kind of all of the clients on one day, so she was thinking about maybe splitting 2 days. So she's still kind of narrowing
Okay.
that in for how it works for the workflow.
And does she have a place to put her stuff? She was working on getting a space,
Yeah, she's working
Fire
out of
station.
the fire station, yeah.
so she is working out of the fire station.
Looks like 27 cents a page for color from Staples.
Thank you, sir.
It's a lot.
Any thoughts on, yeah, it's not cheap to print now, you know? Any other thoughts on, or questions in terms of any of the encounters, any interventions that has happened in August or September?
I just would like to see after we get our flyer out and get some of these circulated, if we can't beef up those numbers for home visits, because the essence of community nursing is the home visit. So, I have very low numbers still.
So I'd like to offer a few comments on the times too. Or on the numbers. Yes and no. They're actually not super low for home visits. When you consider the fact that we are in fact looking at 9 months, right? 9 months ago, nothing existed.
Mhm.
For the purposes of our discussion, people in Enfield didn't even know what a community nurse was.
Right.
So when you apply this to literally any industry, the growth rate's not awful.
Well, that's kind of what I'm saying.
Yeah.
I think we're putting
Right.
out stuff now and more people should know about it.
No,
I'm hoping to see
absolutely.
The numbers come up.
And for hours, I want to point out that these hours are direct deliverables. So, we give you encounters and we give you hours, but we're not giving you any relationship between those two. So our first visits on average take a little over an hour, about an hour and 15-ish. From there, it depends on what people's issues are. It might take 2 minutes or it might still be more than an hour.
Mhm.
So while it says, 36.43, that's direct deliverable hours.
Mhm.
So that means that probably is home visits, outreach, those sort of things. That extra couple hours doesn't mean that she's just sitting there. It means it doesn't fit into one of the categories that we
Mhm.
measure. So just food for thought as we talk about what the numbers actually mean.
Can you clarify for me, when you say hour and 15 minutes for a visit, does that include the documentation?
It does not.
Okay.
So, and honestly, documentation is probably, the other time that is not being seen there.
One thing I noticed in the information that we had, it was actually kind of nice to have 2 months that were like redundant to each other. Cause if you scroll back up to August, we had 1 home visit. You scroll down to September, we had 4 home visits. So there's definitely some comparable data having just those 2 months together. And it shows, growth in that as well.
The other thing I wanted to bring to the committee's attention is I pulled all the data for patients that have reached 6-month maturity. So the way that we measure outcomes is we do a 6-month pre and post evaluation and look at their hospital admissions and 911 calls and emergency room visits. There's been one patient in Enfield that has reached statistical significance. Just one. Or that is, sorry, that's reached,
How did that?
that's reached maturity and there's nothing to compare it against. Because we cannot pull the entire community until the end of the year.
Mm.
The Dartmouth Analytics, doesn't have the bandwidth to offer that to us. So unfortunately, that means that we are going to go into the budget season without outcome data. I can give you the 911 numbers. There's not going to be any significance to them because, we have a numerator but no denominator.
I have a question about the emotional support piece. So can can you tell me what that entails when you're capturing that intervention? Because it seems to be
Kristen,
like.
you wanna take that one?
It's like a consistent one, and if we're talking about marketing it to folks, how do we speak to them? How do we speak about that as well? If, if that is something that, is that appropriate? Is that something that is part of the visit?
Good.
Yeah,
It
I
is.
got that one, Jeremy.
Well, I was gonna
So
say,
y-
the second part of the question is, it's not an appropriate reason for a referral.
Okay.
But go ahead and take it on, Kristen.
Yeah, so as a reminder that the information you're getting, it's kind of coming from two different sources. It's coming from the MIH program and some of Dartmouth's metrics and measures. And then there's also the community nurse connection. So again, taking off my Enfield resident hat and speaking for community nurse connection. So the outcomes that you're seeing, like emotional stat that come from community nurse connection, and the encounters we can compare to other communities. And I will say Jeremy's correct. Like your home visits are, they're a little lower than our average, but it's a startup program that hasn't done any marketing yet. So, it's not kind of off the mark, but emotional support is really well, and reducing isolation are really metrics we know that are saving the healthcare system dollars, they're saving the municipality dollars, and more importantly, they're saving the client dollars. So as Jeremy said, it's not a reason for a referral, but it may be a big part of the reason for a follow-up visit to prevent that person from calling 911 because they're anxious, lonely, they just need emotional support. Which again, if they call 911 and they need it, that's one thing. But if they call 911 just because they were lacking that emotional support, we know it's saving the town of Enfield money from those 911 calls. And again, more importantly, it's saving the client about $500 in unnecessarily or in co-payments if they're unnecessarily transported to the hospital. So it's a really, it's a key metric that Community Nurse Connection is capturing for all the community nurse programs. Did that answer your question?
Yeah, yeah, absolutely. I think it's, if it's that significant, obviously it's probably not just in Enfield, but as we think about future donations and how we speak to that, those statistics are important to say there is cost savings to that by capturing emotion. This program serves that need, and it might not be the reason, directly that we would take that referral, but ultimately the cost saving is there beneficial.
I think this is connected. I want to play devil's advocate for a moment for everybody. And I'm very concerned about how we answer skeptics at town meeting. And so let me play skeptic. August and September, we're getting about 10 encounters per month. Encounters, you know what that means. That includes emails. We're spending what, 3,000 a month? 12 times 3,000 is roughly 35,000 if I did that right. 3,000 a month for 10 encounters. So we're spending $300 per encounter. It's very hard to do this. $300 per encounter. Is that cost effective? Does anybody know? That's the question that we're going to get asked at town meeting.
I think it's pretty typical, like at the visiting nurses at the VNH where I work, we have to lay out what the cost of a visit. I know, well, I do hospice, and the hospice, I mean, it could be like $250 to $300 for a visit. So
That's the charge.
yes, that's charged. So
That's good.
maybe if I had more information on that to kind of give us an idea of what that looks like.
That would be great. I mean, I think if we
Okay.
could answer that, well, if you go to VNA, it's gonna cost you this, about the same.
Or like this is what the VNA is charging our, you know, our system, Medicare, Medicaid, what have you, so this is the going rate. So it's
Then I think-
justifiable.
Then I think your arguments and Kristen's have a lot more weight to them.
Yeah, I
Because you
agree.
can say, look, the cost is
Yeah,
appropriate and there are these additional savings, which are very difficult to.
Well, and
but
not to harp on the marketing piece, right? But as time goes on, at least theoretically, those deliverable hours will be spent less in outreach and more in patient care,
Right.
right? Like there should be, someday there'll be this magic shift of now there's less outreach and more patient care, and then it'll just keep going.
And
Yeah,
that
and
is
there's-
like argument strong.
Yeah.
I hope for the same thing
Yeah.
too, but so
I'll
If you
take a,
can-
I'll take a look and see what I can gather
I
for,
think, if you could just get some round numbers, doesn't matter what.
and if
they
I'm
are.
wrong, I'm sorry, I'll preface.
Oh, no,
But I'm pretty certain that I'm.
if we could get those in the minutes,
Mhm.
then that's the beginning of something that's crucial here, which is putting a story together that we're gonna have to deliver, I think, next fall, just
What-
about a
what's
year
the
from now.
What's the value? That's what you're
Yeah.
looking at. What's the value of these donations? Where are they going?
We're gonna have to convince the select board, is that right? Ed and the select board to support a warrant article for this programs, and that's gonna start about a year from now. Am I right? Warrant articles in the fall, budget in the fall.
Yes.
So we have about a year before we go to the first crucial people.
right.
And after January first, we will have deliverable outcomes. Small, right? We're only at one patient right now, but
You could see how long it's taking to get a mailer out.
I think I would just,
Understandably, but this is a lot more crucial. So,
I think I would just be cautious not to get too far into the rabbit hole of comparative measures because community nursing does not compare to hospice directly. Hospice is a very different service. And so if we're trying to compare, we want to make sure
Home care.
we're trying to do some home care that is
Well,
more
yeah,
apples
that's-
to apples as
that's-
opposed to, okay, all right.
That's kind of what I was referring to
Okay.
as well. Like, I think it's all around the same,
Okay, awesome,
but
good. I just want, that was the one kind of detail, like I don't want to
yeah,
get too
sure.
far into
Absolutely.
things that are not quite as relevant to the
Sure.
community nursing aspect of like what care is provided by our
Sure.
community nurse versus what in-home care
Sure.
would look like by another agency per se.
Sure.
And
And I
I can
think-
help with some of that cost comparison. A quick introduction in the audience, I think, is a Beth, who is actually a student working with Community Nurse Connection. She's an Enfield resident, and she is doing her community nursing project studying Enfield. So she is there to help all of you do some of this work, and it will help her with her class, and she can help you with your presentation. So if you don't know Beth, I think she is there. It's hard for me to see, but please bring her in, use her, share. She can do a lot of this research and the work for you. So thank you, Beth.
Yes. Fantastic.
All right, well, we're at 6:37, so I'm just gonna, any public comments before we close? Thank you for joining us. Beth, hello, hello. And future agenda items, I think we've captured a few things already, the cost estimates, the approval of the next draft. Maybe continued conversation on this value added and comparison of cost. And then we'll go over the program evaluation, and then I think that's it, unless you have other agenda items, then you could, of course, email them to Emily ahead of time. All right. I think we're at 6:37, so any motion to end the meeting? I put the motion to end the meeting. Second,
Second.
all in favor? Great,
wrong.
thank you, everyone.
Thank you, Kristen.
Bye, Kristen.